Madam Speaker, Gillian Levy spent years struggling to get treatment for debilitating endometriosis symptoms. She didn't think she could get pregnant, but in 2024, she found out that she and her husband were expecting a baby. But sadly, the baby miscarried at 19 weeks, which was a deeply traumatic experience. Her follow-up ultrasound showed issues with her uterus that are linked to miscarriage and endometriosis. She never got a follow-up appointment. She had to process the information on her own after reading it on the health app. Speaker, why are women being left to manage their health care alone?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. And I want to extend condolences to that individual and her partner and extended family. Miscarriage is a very, very difficult experience in any family's life. We expect that clinicians will follow up with their patients. We certainly do our very best as government to ensure that we have the things in place that clinicians need. I can't speak to any individual case, but there is a responsibility on all of the clinicians who work in the healthcare system to provide good care. If the individuals are concerned with the care they receive from their individual clinicians, there is an opportunity for them to reach out to the prospective colleges to talk about their care they received. Again, I can't speak to this case as an individual case, but certainly there is expectations that clinicians will follow up with their patients.
I recognize the Honourable Member for Dartmouth North.
Thank you, Madam Speaker. Gillian has been waiting now almost 2 years for a gynecology appointment at the IWK. She's already spent years suffering from serious pain and bleeding. Her bleeding is so bad that she requires regular iron infusions. Her pain is so severe that she's been off work for a year and spends days every month in bed suffering. Speaker, women like Gillian are begging for help while being told that they just have to wait. So when will the minister take meaningful action to improve women's health care in this province and help end this suffering?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So what I want individuals to know is that we work very closely with the IWK, but also with gynecologists across this province. We've recently made sure that all of the regional hospitals in our province have a full complement of OBGYNs, which is essential in order for people to get care close to home. We have invested in the gynae clinic at IWK. There's new facilities for women's health at Wise Road and the Deanne Reeve Pelvic Health Suite. We've invested in terms of equipment. We've invested in human resources. We continue to work with IWK. I meet with them on a monthly basis to understand what their requirements are, as well as Nova Scotia Health. So when people put business cases forward and when we understand what the needs are, we do our very best to support our operators.